Hi, I'm Michael Fossel. Welcome. Thanks for joining me. You're going to see a lot of my gardens here today and a little bit of my house as well. But really, what we're going to focus on is aging itself. And there are three parts of this. There is what is aging in the first place, there is what can you do about it, and then there's what can we do about it. And the major issue that I'm going to be talking about really is can we reverse the aging process? Most people would say that the answer is no. Though, as Jane Austen said, that's no occasion for us to look at it as a certainty. But that's the assumption most people operate on, that maybe you can slow it a bit, but that you can't actually change the aging process. I suggest that that's simply not true. In fact, oddly enough, most people are wrong. This is a quote from Amanda Gorman, and I think she's right. There is always a chance to do something a little better if we're brave enough to see it. But the problem generally is that we make assumptions about what's possible and what's not possible, and those assumptions often get in our way. For example, we make what I call an assumption of understanding. This is a hill that most of you have heard of if you remember your Shakespeare and your Macbeth, because this is Dunsinane Hill. And this is the hill that the witches said that Macbeth would never be conquered unless Great Burnham Wood came to hide Dunsinane Hill, which was, he thought, impossible. He made an assumption. And that clearly was wrong because Malcolm cut down Burnham Wood, used it to shield the soldiers, marched on Dunsinane Hill, and conquered Macbeth. Now, the witches also told Macbeth that he could not be harmed by anyone of woman born. And since Malcolm was the product of a cesarean section, so much for Macbeth. But those are the kind of assumptions that we make as an audience and that Macbeth made as an actor. But those assumptions are ones we continue to make. We've made them, for example, in science. Here's an example from the world's leading physicist some 8 years before the Wright brothers proved him entirely wrong. Now, his assumption of understanding was reasonable enough given what he knew. It's just that that assumption was flawed and he never really examined it. And as Wilbur Wright said here, if we assume what's accepted, there'd be little hope. So often it behooves us to look a little further. So let me take you into my personal life a little bit, take you back about 45 years or a little more than that, when I was at this campus in California. This is Stanford. And it certainly is full of oak trees. And for me, it reminds me of a time that I met my wife. Actually, I met her, I proposed to her 7 days later. She accepted, and the two of us eloped off to Carmel and have been married since. But Stanford means more to me than simply that, which is a great deal to me, because it's where I first began to ask myself what's going on with the aging process. And what I found is that most people had an assumption of understanding. They thought they understood what aging was all about, and they did not. So let me introduce you to another friend of mine. This is Dr. Leonard Hayflick. Leonard Hayflick was the first person ever to describe cell aging 60 years ago now. And he made this quote when he and I were talking about a year ago because we stay in contact. And what he is really saying is that everybody agrees that the single major risk factor for age-related diseases is aging. But then they entirely ignore aging and they move on to what's essentially histology and pathology and signs and symptoms, but they ignore the aging process itself. And I find that's true of most people. They think aging is something that, quote, just happens. You get old, you rust, things fall apart, what do you expect? Which hides a deeper reality, I think, and it's one that we need to look at more carefully. So let's look back and ask ourselves, have we ever done anything about improving lives by dealing with the aging process? And the answer to date has been no. If we ask ourselves, have we increased the lifespan, the mean lifespan, the answer is yes. It's gone from about a quarter century to half century to now about 3/4 century, but with no change over the past several hundred years in the maximum lifespan that we have. So can we not merely improve lives by extending them, but improve lives by making them better lives, higher quality life? And if I look back in history, we certainly have done that. For example, the advent of microbial theory, the idea that little invisible organisms can actually harm us and kill us, was a huge advance, a much more important advance than merely technical advances. For example, a fourth generation cephalosporin or statin drugs or robotic surgery or heart transplants, all of which may improve lives, at least marginally, but they're costly and have side effects and concerns. But microbial theory allowed us to do some things we had never done before in history. For example, the advent of hand washing at delivering of babies drastically cut both the maternal and neonatal death rates and did so while extending the lifespan and making people have better lives. So it didn't cost anything either. The same was true if we look at rabies vaccines and the first antibiotics and the polio vaccine. And when I say it didn't increase the cost of medical care, let me give you an example. In 1950, people were honestly estimating in a number of developed countries that the countries would be medically bankrupt by the year 2000 because of the severe cost of treating children with polio, for example, iron lungs and rehab and braces and so on. Now, that didn't happen. The World Health Organization estimates that in the year 2000, the cost of preventing polio was a little less than 10 cents per child. So much for bankrupting the country. Yet we do the same thing now. We talk about the cost of treating age-related diseases. And I think we're about to undergo a second major revolution in history, which is our understanding of the aging process, which will allow us to both prevent and cure age-related diseases, and in so doing, improve lives, not simply extend lives, but make them better lives, and lower the cost of medical care globally, nationally, and personally. In fact, a lot of this has already gone on, as you'll see a little later. The first time we ever showed we could reverse aging in human cells was now 23 years ago, and in human tissues 21 years ago. And we're aiming to take this off to FDA human trials, as I'll tell you about in a minute. About 25 years ago, actually next month, I gave the first talk ever at the National Institutes of Health here in Bethesda, Maryland, on the topic of what is the aging process, can we understand it, and if we can we actually prevent and cure age-related diseases? Well, I went on from there to put out what was the first book ever on the prospects for doing exactly that and the technical abilities in doing it. Wrote the first articles ever in the medical literature on the prospects for reversing aging and treating age-related disease by doing that. And the first and still only textbook on this, Cells, Aging, and Human Disease, which goes over it in detail, put up by Oxford University Press, very comprehensive textbook. And then finally a book for the general public that the Wall Street Journal called one of the best 5 science books of the year. But it brought us to a point about 2 years ago where the Alzheimer's Association globally asked me to come to Washington as part of a conference that I helped organize on animal models and dementia. And the question is this: why is it that everything works in mice and nothing works in humans? Of course, not everything works in mice either, but in general, a lot of animal studies do very well, but they don't translate into human diseases. And we end up with sort of an empty bottle when it comes to being able to treat dementias, for example. And the question is why? And what I said was that we lacked an understanding of what's going on. And I'll come back to that. But the problem is, as a result, we tend to dig in the wrong places. We are trying to treat and go after what are basically symptoms and signs and outcomes rather than the underlying process. So to quote Indiana Jones and Sala in the movie, they're digging in the wrong place. And as I say here, when you're digging in the wrong place, digging deeper doesn't help. Whether deeper involves more billions of dollars, as we've already spent, for example, going after beta amyloid, or whether you simply put more people into it or more federal funds. It's not a matter of putting in more, it's a matter of digging in the right place in the first place. And what I said was this: we have to have a model, a unified model that explains the dementias and age-related diseases. And as a result, I was asked to write this paper by the editor-in-chief of this journal, who then joined our board. Well, the paper itself ended up generating more than 600 global reprint requests. And what it says is that we need to understand the model. If so, we can predict accurately the outcome of clinical trials. We have to have a model that's consistent with all the known data. And much more importantly, this is a model that offers an innovative point of intervention. And what it is a unified model. It's also a systems model. And when I say unified model, what I mean is has to explain everything. It has to explain the variation within dementias. That is, why does one patient at Alzheimer's have some motor deficits, others don't? One patient with Parkinson's have some cognitive deficits and others don't. Why does somebody get Alzheimer's at age 45, another person gets it at age 95 or not at all? Likewise, between the dementias. Why does one person get Parkinson's, another Lewy body dementia, or Alzheimer's or vascular dementia? Why do different people get different diseases? Also between different animals. Dogs, cats, rhesus monkeys, mice, all have cognitive decline with age, as do people, but they express it in different ways. They have different sorts of deficits and different findings when we look at the brain. Why is that? Likewise, upstream risk factors. For example, we know that exposure to toxins like dioxin, paraquat, rotenone, all increase your risk of Alzheimer's and other dementias, Parkinson's, for example, but we don't know why. We know that head injuries, for example, with football players or hockey players or fighters, will end up with an increased risk of Alzheimer's and Parkinson's, but we don't know why. Or infections or vascular problems. Why is it that these result in dementias? Likewise, downstream findings. We know that most patients in Alzheimer's will have beta amyloid, but some have more than others. Why is that? Likewise, with regard to Parkinson's findings, likewise with other findings. Why do people vary in what they show, either in the histology or the imaging studies? And why are they different? Furthermore, it has to be a systems model. It is not enough simply to list all the upstream risk factors and the downstream findings without explaining what's going on in between it. Let me give you an example of what I mean from engineering. This is the cockpit of an Airbus 380. In the upper right, you're looking at a Rolls-Royce jet engine, not, by the way, the Pratt & Whitney engine that failed recently over Denver. And you're looking at the lower right there, a Trent 900 turbofan that powers the engine and one of the fan blades. Well, if I want to understand what's going on, it is not enough to simply catalog the parts and lay them out on the floor. What I need to do is see how they fit together, how they work together at 35,000 feet, going hundreds of miles an hour at a high RPM and high temperature. In short, there is a system here, not simply a whole list of components. It is not enough to list the signs, the symptoms, the components, the biomarkers. You need to understand what's going on between them. So in medicine, that's certainly true. This is the COVID vaccine, or COVID virus, and it's not enough, again, to understand the signs and symptoms of COVID. It's not enough to know all of these things may occur and other things. What you really need to understand is what the virus does to the human immune system and other organs and what we can do to intervene. The same is true specifically when we come to aging. We can list macroscopic biomarkers, things that you and I see in the mirror, we see in the grocery store, we see in patients. These are all true, but they're not aging. They're outcomes of aging. And to explain a list of biomarkers is not enough to explain what's going on with the aging process. The same is true even when we go at the microscopic level and we look at things like this mitochondria or decline in DNA repair or telomere shortening. None of those by themselves are aging. What they are is parts of aging. We need to understand the entire system as it works in some dynamic process if we're going to make some intervention. Certainly that's true with regard to the dementias. So these are the kinds of things: blood-brain barrier failure, glial activation, alpha-synuclein. These are the kinds of things we see in patients with Alzheimer's, but they're not Alzheimer's or other dementias. Parkinson's, for example. What they are is simply biomarkers. They're not an explanation of the process, nor is it enough simply to know the genes. For example, we know that two ApoE4 alleles listed on top there increase your risk of Alzheimer's, but some patients have that and don't have Alzheimer's. Other patients don't have that and do have Alzheimer's. So what's going on? It is simply not enough to know all the list of genes and their relative risks. What we need to do is understand how you go from gene to disease. In short, unless we understand aging, how can we understand age-related disease? And how can we intervene and effectively cure and prevent age-related disease? So let me take you back a little bit, and let's look at the aging process itself more carefully. We know that different species age at different rates. For example, human beings, as I say, live about 75 years now. Gorillas in the upper left there live about 40 years. That's Coco with Allball. I actually was her babysitter for a year. I'm probably the only person you'd ever meet who has wrestled with, been bitten by, and kissed a gorilla. I will miss her. She actually had a bigger sign language vocabulary than I did or do. Typical domestic animals live about 15, 20 years, depending on the breed. Typical laboratory animals, rodents, 2 or 3 years, depending on the breed. Well, why do they age at different rates? You could say it's just wear and tear, but then you have to explain why wear and tear occurs at different rates. You could say it's simply genetic, which is true, but you'll notice that, again, that's not an explanation. All you've done is identified some genes without explaining what they do. So let me give you an example within human beings. These are 30 young friends of mine. These are progeric children. I used to gather them together from all over the world, along with Bill Sample in the background with his hands up. And we would take them around different spots. And this year we took them to Washington, and we took them for a tour of the White House. And we were doing fine throughout the tour until Sammy and Ori in the front row there on the left, the red baseball cap and the orange Hawaiian shirt, managed to sit on the pressure sensor just inside the door on the left that leads up to the presidential quarters, at which point the Secret Service escorted us very politely out the door. And we took this picture on the North Portico. Now, these children have osteoarthritis, they have osteoporosis, they have thin skin. The ones that you see with hair are wearing wigs. They're generally bald, and they die overwhelmingly of age-related vascular disease, that is strokes and heart attacks. Almost every child within the next few years in this picture died of a stroke or heart attack. Their average age of death is 12.7. Why do these children die so young? Well, we know the gene, it's a lamin A gene, but again, that's not an explanation. All we've done now is identify a correlation without explaining the causation. How do we go from gene to progeric children and an early death? Well, we also know that aging is not universal. For example, every cell in your body derives from a fertilized cell that you got generally from your mother, who got it from her mother, it was already a couple decades old, who got it from her mother, a couple decades older. And that line of cells goes back almost 5 billion years, 4.5 billion years. And during those billions of years, that line of cells never aged. And yet, the cells in your body show age changes over the past several decades. Many people would say aging is related to mitochondrial function, which we'll come back to. But the problem is that your mitochondria, every one of them came from your mother, who got from her mother, and that set of mitochondria go back almost 2 billion years, 1.7 plus billion years. And during those several billion years, that line of mitochondria never aged. So why is it the mitochondria in your body, if I measure them, would show age-related changes now? Well, part of it is this. It's the difference between weeds and weeding. Again, welcome to some of my gardens. The reason that some gardens do well is not because they don't have weeds, it's because they are carefully weeded. It is not a matter of wear and tear, it's a matter of maintenance. But the same is true of human cells. So if I'm looking at the germ cell line, it has maintained itself flawlessly for billions of years in the face of wear and tear, entropy. That's not as true if I look at the cells in the hand of that 80-year-old man in the wheelchair at the left, whether I'm looking at the fibroblasts, the keratinocytes, the endocytes, you name them. If I look at any of the cells in that hand, what I see is that entropy has continued, wear and tear has continued, but maintenance has slowly gone downhill. In fact, to quote Alice in Wonderland, you could say what's really going on, as the Red Queen said, is that you have to run as fast as you can just to stay in one place. And that's true. In order to carefully maintain a normal cell, what you have to do is maintain maintenance in the face of wear and tear. Now, to sum up everything that's going on and then move on to what we can do about it, as Jane Austen said, let me give you this overview. As you age and as things happen to your body, for example, as I touch my skin, I lose cells, and there are replacement cells. So my remaining cells divide. When that happens, the telomere, we'll come back to it, but it's a piece of the inner chromosome, shortens, and that changes the pattern of gene expression. The result of that is slower molecular recycling. And the result of that is that cells begin to fail and die, and you and I get age-related diseases. That's the telomere. It's a little piece at the end of the chromosome. And you might think of it as the conductor of a symphony orchestra. So your genes then are the musical instruments. And the telomere sort of sets not only the tempo, but sets in many ways the actual choice of music that's being played. So the difference between a young cell and an old cell is not that the oboe's reed is split or that the piano's out of tune or the first violinist has the influenza that day. The difference is the choice of what you're playing and the tempo it's being played at, and that's set by the telomere. So again, the difference between my cells at age 7 and my cells now at age 70 is not that they have different instruments, it's that they're playing a different tune at a different tempo. And that tempo looks like this. No matter what molecules I'm looking at, for example, the collagen, the elastin behind these wrinkles, or the beta amyloid in my brain, or any other set of molecules in my whole body, if I look at them, what I find is that in young cells, they are being recycled very fast. So I, for example, make collagen, then I break it down and replace it, and I make more collagen and I replace it, continually recycling it. So when there's damage, signified here by the little red star, it's washed out in a young cell. In short, young cells are running very fast to stay in one place. Whereas in your 40s, 30s, and 40s and 50s, that's getting slower. And as you get older, they barely run at all. So the outcome is you begin to get more and more dysfunctional collagen and elastin, for example, and the outcome of that is the wrinkles. And that's also true if we look at generally all of the cells and all the molecules in your body. In a young cell, the turnover rate is very fast, and the damage rate then is very low, the amount of damage. Whereas in older cells, when the turnover slows down, the damage begins to accumulate, and you and I get age-related diseases. We could look at any organ in your body. We could look at your knees. We could look at your coronary arteries. We can look at your bones. In this case, we're going to take a look at your brain for a second and look at how the recycling works. Now, all number of things recycle in the brain. We're going to look at the classic, which is beta amyloid. It turns out we can measure this. We can measure how fast beta amyloid is recycled. That is, some of the cells in your brain, for example, the glial cells, produce it, secrete it, rebind it, internalize it, degrade it, produce it again, secrete it, and so on. It's a continual recycling process. And the outcome is, in a young person, there's very little in the way of sort of denatured and sticky beta amyloid microaggregates. But as, again, you get older, what you find is more and more of these tend to accumulate because you're slowing down your rate of recycling or turnover. Now, if you're very lucky and you have two ApoE2 alleles, which are low risk, what you find is your molecules aren't very sticky. So even in the middle age or even as an elderly person, you don't tend to make much in the way of beta amyloid microaggregates. And so you don't tend to get, in this case, Alzheimer's disease. But if you're unlucky and have two ApoE4 alleles, you tend to make stickier molecules. That's why, in general, patients with these alleles tend to get Alzheimer's disease at an earlier age and more severely. In all cases, though, no matter what you've got for genes, everything's being played out on this single stage of cell aging. And the same is true as you begin to get further and further into old age, and you begin to get these beta amyloid plaques. The same is true whether we're looking at beta amyloid or tau tangles, mitochondrial dysfunction, or anything else in the brain, or for that matter, elsewhere in the body. And the outcome of that, of course, in the brain is this: cell failure and dementia. If we look at the mitochondria, the same thing's going on. All of the major proteins in the mitochondria come from the nucleus, and it's much slower as we get older in the rate of recycling. So the outcome is the mitochondria becomes more dysfunctional. It's making less in the way of energy and more in the way of free radicals. The membrane around the mitochondria is also being recycled more slowly, and it gets leakier. The scavenger molecules seen here in blue, like catalase and superoxide dismutase, are also being turned over more slowly, so they're not as effective. And then when you get damage, that's likewise not turned over. So as we get older, it's not the mitochondria's fault. It's just playing a different tune back in the nucleus. The same thing is true within the nucleus for your DNA. Since you and I have been talking for the last 21 minutes, every single cell in your body has had genetic damage, and you have repaired it flawlessly. But as you get older, the four major families of enzymes responsible for DNA repair are being recycled more slowly. So you begin to have more and more accrued DNA damage, which is why, as you and I get older, we begin to have a higher risk of cancer. Not simply because you have a lifetime exposure to carcinogens, but because you're no longer repairing the damage as fast as you used to when you were a child. So again, overall, this is what's going on. You have things that are going on upstream, personal targets, I'll call them, like your age itself, genetic factors, exposure to toxins, trauma, radiation, for example, ultraviolet exposure, stress in general. All of these things play a role in increasing your rate of cell division. And when that happens, the telomeres shorten. When that happens, that changes the rate of gene expression, or the pattern of gene expression, which changes the rate of molecular turnover, which means that cells become dysfunctional and you and I get age-related diseases. We often see those downstream as biomarkers like beta amyloid, tau tangles, and so on. The problem is that none of these downstream targets have proved effective. There have been more than 1,100 interventional trials aimed at things like beta amyloid and tau tangles, and by global consensus, they've failed to help. Now, there are the personal targets, which you and I can go after, and I encourage you to do that. Some you can't do much about, your age itself or the genetic risk factors you start with, but there are a number of things you can do to change your rate of aging. And they're all sort of listed here. Obviously, you want to avoid certain things. You want to keep a normal blood pressure, have good glycemic control, a better diet, lowering your stress. Maybe you meditate, avoiding infections. All of these things are true. And as I note here, sort of the irony is that your grandmother told you these, your doctor told you these, your doctor cost more, and you probably didn't pay much attention to either one. But those are things you can do to change your rate of aging. Please do. Let me talk about things that I can do to change your direction of aging. And that is to intervene effectively in the aging process itself by changing telomeres using a thing called telomerase. And that way, reset gene expression. Well, that sounds good theoretically, but can we do it? The answer is actually it's already been done. This is an article from Science magazine 23 years ago by Andrea Bodnar and her colleagues out at Jaron in California. And what she and the group there did was use telomerase to reset the pattern of gene expression you're seeing here in old cells, and it goes right back to the same pattern you see in young cells. In short, we showed we could reverse aging in human cells 23 years ago. How about tissues? This is an article by Walter Funk in that same group. And what Walter and Andrea and everybody else did out at Jaron is they showed that you could take old human skin cells and grow young human skin by using telomerase. So we know we can reverse aging. And furthermore, you can not only do it in human cells and in human tissues like skin, but you can do it in human bone. You can do it in human blood vessels, for example, coronary arteries. You can take old coronary artery tissue and grow young coronary artery tissue. So we know that's possible. What about animals? The first study ever was actually done 10 years ago by Ron DePino's group at Harvard. This is the second study that's critical, done by Maria Blasco's group in Madrid. And what Maria did is use a technique that I can use for human trials in the FDA. She showed she could increase the lifespan, but also improve the behavior of these animals as they get older, and the physiology, for example, the bone mineral density, or the subcutaneous fat, and dozens of other factors. So we know that it's possible to at least partially reset the aging process within our technical ability. So what we're going to do is take this to human trials. We're going to show we can restore normal function to aging cells. We're going to start by using telomerase therapy and targeting Alzheimer's disease. We're then going to go on from Alzheimer's disease to not only the other dementias, for example, Parkinson's, but vascular disease, that is strokes, heart attacks, congestive heart failure, peripheral vascular disease, as well as osteoarthritis, osteoporosis, and other age-related diseases, as well as skin aging and so on. Now, back to what you can do in the meantime and the broader perspective. This is a quote from the Dalai Lama, as you see. If you want others to be happy, practice compassion. But if you want to be happy, you still practice compassion. To me, that's the reason we do this. It's certainly not a matter of extending the lifespan. It's a matter of improving the lifespan by caring for other people. It also takes imagination, but you can't have it run away with you. So as Agatha Christie said, imagination is a good servant, but a bad master. I encourage you to think about what can be done without getting overwhelmed by just your wishes about what could be done. Attitude. I had the pleasure once of speaking with Maya Angelou at a conference once. Delightful woman. If you don't like something, change it. If you can't change it, change your attitude. Attitude really is everything. Accept what you have to. And live your life. Emily Dickinson said, to live is so startling, it leaves little time for anything else. You need to live your life to the fullest. And whether we can do anything about that or not remains to be seen, but we'll certainly try. So we're about to do something truly remarkable, I think. But in the meantime, I encourage you all to remain as healthy as you possibly can. And I thank you very much for joining me. Anybody's interested, they're welcome to get in touch with me. I'd be more than happy to hear from you. Thank you again.